My name is Niamh Lennox-Tugani, and I'm going to take you through a very short summary of our 2-year evaluation of the real-world use of artificial intelligence in breast screening. The findings of this evaluation have implications for both policy and practice. This was the first project of its kind in England, so the evaluation was the first of its kind too. We asked several questions, and here we focus on 3. What do breast screening unit staff think about using AI to read mammograms and organise clinics? What do women in the general public invited to breast screening appointments think about using AI in this way? And what will be the effect of introducing AI on the efficiency and quality of the breast screening service? We collected survey data, reviewed documents, and interviewed decision makers from 4 NHS trusts, over 100 staff from the breast screening units, and over 4,000 women in the East Midlands of England. To understand if the technologies being introduced are addressing the problems that are important to staff, we asked them what the biggest problems facing them were. Almost 100% identified shortages of staff as the biggest problem. The AI solutions being tested as part of this project are likely to address this problem. The AI second reader of mammograms could replace one of the 2 health professionals who need to read and report on every mammogram taken. The machine learning tool could bring together all the information needed to administer breast screening and help managers plan for any changes to the service. Right now, this is all done manually. When we asked health workers and women in the general public how well they understood AI and what they understood AI to be, they told us they're still confused about what makes artificial intelligence different from traditional computer software. Much of their understanding is rooted in movies and popular culture. Interestingly, women in the general public rated their own understanding of AI at similar levels to health professionals in the breast screening service. While many health workers in breast screening are positive about using AI in the service, a substantial minority are still unsure if they trust the technology or not. This mirrors the findings of other studies looking at the attitudes of radiologists to the use of AI in medical imaging. This view did not change much over the course of the evaluation. In fact, the more clinicians read about the potential of AI image readers in breast screening, the more they want to see the evidence about the clinical accuracy and safety of the technology. They also want to be involved in designing real-world validation studies when the technology starts being used in the breast screening program more widely. Women are positive about the potential for AI, both as a second reader and in helping to manage a complex and big program. Women aged 50 to 70 years old who are in the program today are more positive than younger women, probably because they have more of a direct interest in the program running as effectively as possible. Women are also more positive about the use of AI in breast screening than they are about the wider effect of AI on society. Women do want to see the evidence about safety, accuracy and security of AI tools used to read mammograms or to manage services. Or they need to be confident that the health professionals involved in the program have seen and believe the evidence. Women are not sure if they need to know if AI is being used to manage the breast screening program, but would want to know if an AI mammogram reader was being used. Projects like this succeed or fail based on the willingness of people in organisations to face challenges and work hard, sometimes slowly, to find solutions. In this case, the project was properly resourced and had the commitment of organisational leadership and a collective of partners to see it through these challenges. AI is novel in general, but more specifically in healthcare despite the hype. Policymakers and regulators in England and globally are working hard to keep up, and projects like this one are helping to inform policy and regulation. Trust in AI is a key issue in the governance and accountability for AI in healthcare, and this remains to be addressed. Our modelling showed that if the AI second reader was used in the 2 NHS trusts where the technology was tested, that they could save 42% of human reader time. This would provide women with a faster service, especially when waiting for results, and free health professionals up to see more women. Whether this modelling can be generalised to other breast screening units will need to be evaluated. So what does this mean in practice? We identified implications for national policymakers, breast screening service providers, health workers, and women targeted by breast screening. For policymakers in England, much progress is being made in this area, led by the AI Lab at NHSX. However, this study identified a gap in the inclusion and active involvement of healthcare professionals and the wider public in developing policy and regulation of AI in healthcare. If the trust gap is going to be closed, this will need to be addressed. When starting to use AI in patient care, NHS trusts need to provide health workers with the skills to understand and use these tools effectively and safely, and have the other organisational capacity in place to make best use of the new technology. This means making sure you have information governance and change management support in place from the beginning. AI technology, because of its role in decision support, has the potential to significantly change pathways and common practices in healthcare. The anticipated and unanticipated consequences of this need to be fully understood, and only health workers really understand what they are. Health workers need support and space to learn about the new technology, how it works, can enhance their work, and developers need to listen to any concerns they may have. Women should be encouraged to ask whether and how AI is being used to manage the service or read mammograms. Women from a variety of backgrounds have much to offer in helping technology developers and services get their communication of AI and its use in the service right. There is a summary and a full technical report available on the MRED website if you want to read about the project in more detail. You can find it by clicking on this link. If you have any questions, please get in touch. Thank you.